After having a mastectomy, it's common to consider getting breast reconstruction. It can be helpful for a person's mental health, confidence, and how they feel about their body. Before making a decision, it's important to think about how it aligns with personal goals and to ask questions, such as, is there enough time for recovery? Are there future surgeries that may be necessary? Would it be okay to have a flat chest? Keep these considerations in mind as we look at the 3 different options when faced with a mastectomy: flat closure, reconstruction with tissue expanders and implants, and flap surgery. Flat closure, also known as simple flat closure or no reconstruction, is when the breast tissue is removed and no breast shape is created. This is a choice for individuals who prefer not to have breast reconstruction. It is also the fastest way to recover because it carries a low chance of complications and doesn't require any extra surgeries to be concerned about. If a person wants to have the appearance of breasts without reconstruction, they can also use a breast prosthesis. These are special inserts that can be placed in a bra to create the shape of a breast. The second option is to have reconstruction with tissue expanders and implants. Tissue expanders and implants are 2 different devices with unique functions, and they work together to reconstruct the breast. When the breast skin isn't healthy enough after a mastectomy, or if radiation is needed, a tissue expander is used. Over a period of a few months, the skin is gradually expanded by adding saline to the tissue expander. When the desired size is reached, the tissue expander is replaced with an implant during a second surgery. An implant can be put over or under the chest muscle and will need a scaffold to keep it in place. The final result will leave a scar on the breast. It's important to know that implants are not a permanent solution. On average, patients may need revision surgery after 8 years. And no matter how skilled the surgeon is, there are always risks associated with surgery. These risks can vary depending on a person's health. On average, surgical complications may include a 10% risk of infection, a 10% risk of trouble with healing, 15% chance of scarring around the implant. And for every year, an additional 1% chance of an implant leak. After a person's implant surgery, they can usually go home the same day and may feel better within 2 weeks. This option may be a good choice for people who want a shorter recovery time, so they can return to their normal lives. The third option is flap surgery. Flap surgery involves taking a combination of skin, fat, and sometimes muscle from one part of the body and moving it to the chest to reconstruct the breast. For example, 2 of the most common flap surgeries are tram and deep flap. The tram flap takes skin, fat, and muscle from the belly, while deep only takes the skin and fat. Another common flap surgery is the lat flap. This requires skin, fat, and muscle from the upper back. The choice of where your flap will be taken from will depend on the person's body type. For whichever flap is needed, there will always be 2 separate scars and 2 areas that need healing. After flap surgery, a person will likely stay in the hospital for 2 to 5 days and take an additional 6 weeks to recover. During that time, they may feel tired or sore. But once recovered, they can go back to doing regular activities like exercising and returning to work. Flaps can also come with risks. During recovery, there's a 5% chance of additional surgery to save a flap. There's a 1% chance of losing the flap. And in the long run, there's a 3% chance of weakness or a hernia in the belly area if the tummy tissue is used. But if it all goes well, there are no additional surgeries needed as flaps are natural and will last a lifetime. To recap, the 3 options were flat closure, tissue expanders and implants, and flaps. Now, let's look at the possible timing options for reconstruction. If a person chooses reconstruction, there are two possible timeframes for when a breast can be rebuilt: immediate and delayed. Immediate reconstruction is done at the same time as a mastectomy. If a person decides to take this route, they can ask their surgeon about the possibility of keeping some of their breast skin, nipple, and areola. However, the location of the cancer and the size of the breast determine the final decision. Following a mastectomy, cancer treatments are often needed. This may impact the new breast. For example, radiation treatment carries a 15% chance of scarring around the implant, which makes the breast feel tight and uncomfortable. To avoid this, some people choose delayed reconstruction. Delayed reconstruction is a surgery done after a mastectomy. This gives a person time to finish their cancer treatments and to decide how they want to rebuild their breast. However, delayed reconstruction requires an additional surgery compared to immediate reconstruction. If delayed reconstruction is the final decision, patients can ask for a skin-sparing procedure for the mastectomy. This helps preserve as much skin as possible for later use to rebuild the breast. For all recoveries, there are a few extra things to know. 1. Temporary drainage tubes are involved in the recovery process. These are devices that allow excess fluid to leave the surgical area. They need to be properly cared for 1 to 2 weeks after surgery. 2. Even if the results are excellent, the new breast can still change over time. Both weight loss and radiation can affect its shape and size. 3. If these changes cause discomfort or dissatisfaction, let the surgeon know. It's normal to feel overwhelmed when deciding about breast reconstruction, but you don't have to do it alone. Don't hesitate to ask your medical team for more information. Remember that the decision to undergo reconstruction is a personal choice, so take your time and choose what feels right for you.